Preventable health conditions are costing G20 economies over $1 trillion every year in lost productivity. Yet preventive healthcare, from life course immunization to early detection, early diagnosis, early treatment, they can provide significant economic and social benefits.
We did a benefit cost analysis looking at the return on investment of the programs that I just mentioned across those countries, and indeed the return on investment is about $19, euros, pounds, doesn't matter, for every single $1 invested. The benefits of vaccination are real, but they are very diffuse. They accrue to individuals, to the healthcare system, and to economies, and that makes it much harder to understand who should be taking the responsibility, the proactivity, the first step to put in that one that will help us unlock the 19.
In the European Union, we have less than 5% of the world population, and we spend more than 50% of the money spent globally for welfare. This, of course, is unsustainable, particularly if we are in trouble with wars, with economic recession, with climate change, with biodiversity collapse. So we face so many crises altogether, we have to act. The problem is, how do we convince Prime Minister and Minister of Finance who are in charge to take the most appropriate decision?
Well, that's the million-dollar question.
And this is essentially a matter of fiscal sustainability. So our proposal is, again, together with the expenditure for defense in Europe, again from a European Union perspective, bring this chapter of prevention outside of the Financial Stability Fund, which means that countries can spend freely in prevention, in cancer screening, in improving and modifying lifestyles and immunization without the concern that this is going to be affecting their public debt.
The workforce itself is aging. And so, between now and 2060, you're going to have about 30% of the health workforce that will be between 50 and 64. And I think there is a very powerful productivity and economic imperative for employers themselves in keeping that workforce healthy. And at the moment, we are not really able to do that. So we know that we're living longer, but the extra years of life are not necessarily lived in good health.
Prevention was initially seen as a nice to do. So rather than a must do. If you are in a fiscal constraints or like low resource settings, your priority is when people are in hospital, you want to treat them. It's more fanciful, it's something people see. So it doesn't usually come intuitively, the value of, let's say, immunization, the value of making sure family planning commodities are available. And you'd realize that that's really where the work is. Those of us in the policy spaces, those of us in the science, whether researchers, etc., we need to realize that this whole making prevention an agenda for the purse holders, for the politicians, boils down to how much we empower the people, how much we educate them on the benefits of prevention and health promotion, for them to demand that of the politician. That is the only way we win it.
There are 12,700 compounds in clinical development at the moment. That's an extraordinary amount. That's across industry, it's across academia, etc. And we have the rise of artificial intelligence as well, that has the potential to really help make our R&D efforts a lot more targeted, a lot more successful in future. So I think if we can sustain an environment that continues to nurture and reward innovation, there is a lot of reward that can be reaped out of this, and that can be turned back into interventions which are actually cost-saving for society. We need both a mind shift and a policy shift from treating illness as a cost to investing in health as a driver of economic growth. We know there are a lot of out-of-pocket expenses for patients in some countries, and reducing those is critically important.
I mean, we need to really make sure that we think and always bear in mind that what we're talking about is having a system, prevention and support that deliver to people. And I think it goes back to what you were saying at the very much beginning. We need to get that also force that comes from individuals per se that can mobilize change as we move forward.
In this very fragmented times, one of the pathways, perhaps the key one to even, going ahead with prevention, is our ability to make friends, to build networks, to have conversations. It will take us further, and to build these coalitions, whether across sectors, with the private sector, for policy and research to come together. Just that power to come together, to believe in this, would take us really far in making it happen.